and welcome back to the Nutrimedical Report. We have Clay across, and Clay, of course, our team, a Nutrimed team, one of the most knowledgeable of all the different components of our Nutrimeds, and we just have our big supply now of Mega Muscles. We're shipping it literally today. We've got some amazing new products, and I've been doing, of course, I've been extremely busy over the weekend working on upgrading all of our product list. We're going to actually embed live stream TV video clips in every one of the products. So you'll be able to hit the clip and actually watch a video to explain more about it, either PowerPoint or other materials we're going to post. Clay, let's talk about some of the new products we've just recently launched. Brain Mag, and now, of course, Mega Muscles. Can you explain the details of what's in these? And, of course, we have one coming down the pike in about, I'd say, a month and a half. And it is the avian product we talked about in capsule form that has 26 different immunoglobulins that literally transfers to your immune system without vaccines, the immune memory to fight all the major pathogens that affect humans. This is a major breakthrough. Again, I hear about all of the discussion on vaccines. The vaccine manufacturers couldn't make vaccines with a standard which doesn't include toxic adjuvants, heavy metals, or plasmids of things like rabies or other things that are insane, or unstable chromosome things that actually will disturb your normal epigenetics and control your chromosomes, but they don't, because they have the vaccine court and they get away with murder. Now, just a month ago, the courts in the British, in the UK, gave $90 million to injured children to their parents due to vaccines. Here in America, of course, the state of California is going to get major lawsuits against the doctors, the nurses giving the vaccines, the hospital corporations, and the state. They're going to get their butt sued off, and I'll be one of the ones actually suing them. I'll be putting financial and legal help in to try to make certain they get totally sued to death. And people need to understand how serious this is. So tell us all about these latest new products, including this new one that's coming down the road, the new avian immunoglobulin product. And I haven't thought of a name yet, but it's in the works, and it'll hopefully be dynamic to explain to people the whole process of how to protect your immune system without putting something toxic in it that's going to ruin it.
Yeah, great. I really love the Brain Mag, magnesium threonate, and other forms of magnesium, the glycinate form. It's in a powder. It tastes like berry. It tastes great. I've been taking it myself. I love how I feel on it. Helps me get into a deeper rest and sleep. Helps me stay more focused throughout the day. All kinds of great studies on this form of magnesium in the scientific literature for memory improvement for the elderly specifically. And I just think this is something everyone over the age of 40 years old should be on. What do you think about it? Have you been taking it yourself?
Oh, yeah, I take it all day long. In fact, I have my cup on my desk all day long. And what I do is this is what I put in my drink. So people, if they want to copy what Deagle does, I put in I have a big 22-ounce thermos. I put in one of the big sachets of the Sports Energy Light. I put in 3 scoops of Brain Mag and 2 scoops of Calm Mind. I put in half a teaspoon each of ALC 1000, which is acetylcarnitine, and half a scoop of D-ribose, and it's amazing. And then, of course, I'll top that up either with water, or I'll use my pure water system water that's put through my soda stream. So if I want to add a little flavor to that, but you don't really need to because it's a mixed berry flavor, it's amazing. And you can't beat it. It's just, it's unbelievable. The energy, the protection against oxidative stress, the electrolytes. That's why it's actually stored in nitrogen, the Sports Energy Lights. And this Brain Mag is going to, people are trying to recover from extra stress, any kind of health problem at all. It's amazing what it'll do.
Yeah, very good. Really like it. Tastes great too. You mix it with just a little bit of water, and it tastes fantastic.
Yeah, it does. Tell us about this new immunoglobulin product. Tell us all of the research that's gone in, and it's been years of research by a lot of teams of scientists to develop it. So tell us what's going on.
Yeah, well, it's basically it's from chicken eggs, and they inoculate the chickens with a different bacteria and viruses, and the chickens, they create immunity to them, and it comes out in the egg, and then they harvest the egg and clean it and extract the immunoglobulin. from it and put it into a capsule so that we can take it and help us then fight through passive defense, the passive immune system, all kinds of bad bacteria and viruses that are in our environment. So very effective at doing that.
Yeah, and tell us some of the different things that it'll protect against, which I think people should understand. There aren't vaccines for these, by the way, but this immediately transfers to your immune system on an ongoing basis. You need to take it ongoing. It'll transfer your ability to protect yourself against everything from strep pneumonia, Staph aureus, bacteria on your skin, all kinds of different illnesses that could otherwise affect you. This literally boosts your immune system to fight all the major pathogens that will cause everything from dysentery to bronchitis to sinus infections. It's a pretty amazing breakthrough, isn't it?
It is, yeah. I mean, it's something that my daughter and I are going down to Mexico on a mission trip in July. We'll be taking this with us. We'll be taking this every single day while we're out of country to protect ourselves from all the foodborne pathogens.
That's right. And then traveling out of country, it's really important to understand that you're putting yourself at risk of getting into trouble. And you don't want to get sick, but you don't also want to take toxic drugs. For example, a lot of people aren't aware. You take our things like this new immunoglobulin, take Nutrimune to boost your immune system and Nutridefense, which is IP6, and it's things for your immunoglobulins. Nutridefense is very good. This new immunoglobulin will add another dimension to that, where it actually transfers to your immune system your humoral, which is your antibodies, and your cellular immunity, the ability to fight all the major pathogens that can affect you. That's pretty exciting, isn't it?
It is, yeah. Sure.
Now,
what about the muscle? Did you say you had the muscle builder?
Yeah, the mega muscles. Let's talk about mega muscles, because I think people should understand what mega muscles means. It means that when you take mega muscles, you're taking a combination of amino acids that's going to build up not only skeletal muscles like your spine and your greater muscles of your body, but also smooth muscle, your heart muscle, and your blood vessel muscles, because those amino acids are going to strengthen the muscles. People don't realize between the energy metabolism of your mitochondria, which we support with our triad of Nutritrella, and Regenerex and cell detox glutathione. You're also going to raise it with our CoQ10 Supreme, CoQ10 Ubiquinol, and our VascuCare, which is a special propionyl L-carnitine, and ion channel prepare with gamma E, magnesium glycinate malate, magnesium taurate, forskolin, etc. The mega muscles is just really good, because whether you're an elderly person trying to get enough strength to get out of your easy chair so you can go for walks for miles, or you're a person trying to build muscle and shunt your calories into muscle building rather than into fat, this is the formula, isn't it?
Yeah, it's actually studied in elderly patients that were bedridden. And what typically happens when the elderly are bedridden is that they lose weight and then what's called cachexia, and then they can die. And so this is studied on the sickest and worst off, and they found that they maintain their muscle mass by taking just one scoop of this a day. And so, I mean, that's unheard of in a hospital setting, to be able to maintain your muscle mass. They try to give the elderly patients junky stuff, junky proteins that are commonly found in the marketplace, and that doesn't work. So just by giving them one scoop of this, they maintain their muscle mass, and as a result, they're able to get well and get out of the hospital, and that's the goal. So imagine what this would do in a healthy individual who's trying to just build some extra muscle.
Right, post-op recovery, whether it's and not only for muscle, this is the other thing, is if you're trying to rebuild the tensile strength of post-operative suture lines after you've been cut because you had orthopedic or abdominal or other surgery. If you're trying to build up a positive nitrogen balance in your body post a major illness, this is the formula to take. So when we come back, I'm going to talk about some of our latest consults and solutions, and they'll be posted up on our wellness conditions. Dr. Yu book is coming along very nicely, and a lot of new research I want to announce I'm doing with our team of scientists coming over from China and Russia. Back in a minute.
John Huebner from Midas Resources. Are you tired of watching your hard-earned ass?
Welcome back to the Nutrimedical Report. One of the things I think people should understand is that when they have a physiological problem, one of the more common ones we see is chronic constipation, especially in women. And one of my favorite products for that is colon cleanse, but we have a number of other issues that are often a factor. And a lot of people don't realize when you have abnormal peristalsis of your bowel, and it can be due to things like abnormal sugars from lactose intolerance. So lactose blocker, believe it or not, is one of the best things to help stop it, because when glucose and galactose, which is a disaccharide called lactose, is in your gut, so lactose blocker will actually remove that. We have colon cleanse. That's the best stimulant to clean your bowel and clean the bowel wall. Oftentimes when people have dysbiosis, they actually are having abnormal digestion. Digestes, gastrozyme. Digestes restore your stomach acid and pepsin, and gastrozyme your digestive enzymes. And then to heal the gut wall, Gastro Heal. And you have to recolonize with Living Probiotic Ultra. And we want to clean the gut from pathogens and yeast. We use berberstatin and allicin med and IBS care to restore the normal peristalsis with a slow-release form of carnitine. It'll restore the normal peristaltic waves of the gut. So it's a complex problem. If you don't take care of your lower colon, you end up with diverticuli, which, by the way, over age 40, 50% of the population. By age 60, it's around 80% have diverticuli. They're basically like an appendix ready to burst on your left side of your colon. And, of course, deconjugating bacteria re-release toxins and produce colon cancer, and also re-release the toxins to be bioconcentrated in your distant organs like your brain, pancreas, breast, liver, and prostate for males. So it's a big deal. Maintaining colon health is extremely important to prevent cancer throughout the body, not just in the colon. So let's talk about digestion. Colon cleanse, Digestes, Gastrozyme, Lactose Blocker, Living Probiotic Ultra, and Gastro Heal, and these other things. A lot of people think that dealing with chronic constipation is just a minor thing. No, it's not. It's a big deal. And if you don't, you end up with a partial colectomy or your ruptured appendix, like structure on the left side of your bowel. We call them left-sided appendicitis when these diverticuli rupture and create peritonitis. They're very dangerous. And it's also because of deconjugating bacteria. It's a primary cause of cancer, not only in the bowel but elsewhere. So, Clay, let's talk about this for a minute, because I think a lot of people think just being constipated is not a big deal.
Yeah, I really like the colon cleanse. I think it's something that is gentle enough that you could be on it every night. Wouldn't you agree?
Oh, yeah. Yeah. I tell people if you're having any kind of constipation, you want to take one at night. If you're really constipated, you take one twice a day. And I had one lady who contacted us. She said it made her feel sour. And I think, well, no, you're not going to get acidity from any of the supplements I just mentioned. What you may be doing is you're in the process of detoxing. When Big John Wayne died, he had, I think, something like 35 pounds of stool, like layers inside an old pipe in his lower colon. There's a direct link between, we call plaque in your lower bowel, and heart disease, vascular problems, cancer elsewhere, because of deconjugating bacteria re-release toxins. It's a major, major problem, and it's not recognized in our culture. I remember back when I was a resident, and I was assisting doing heart and other types of surgery, and we had one senior surgery resident from Nairobi, Kenya. And Nairobi's a big city. Most people don't realize how big it is. It's 9.5 million people back then. Now it's probably well over 12 or 13 million. It's huge. And they didn't have one case of cardiac bypass disease. They never needed to do bypasses because they ate a African-style diet, which has tremendously more fiber and a lot less garbage in the diet back then. So we had to actually come to North America to learn how to do, cardiac vascular surgery, because they're basically, except Westerners that visit and need a bypass, it's just not seen. They have other illnesses they die of, like parasites and surgical things like, fluke disease in their liver and so on, but they do not have cardiac surgery like we do in North America. And it's all, again, related to colon health. So tell us about colon cleanse, Digestes, and Gastrozyme. And, of course, especially things like lactose blocker and things that are going to clear your bowel, like berberstatin and allicin med. People should realize if you don't maintain body hygiene and balance, you're going to get sick. You're going to have a horrible illness, and it may be quite distant. You might not connect the bowel with breast cancer, but there's a direct link.
Yeah, that's right. Dysbiosis, there's a enzyme called beta-glucuronidase that cleaves bound estrogen in the bowel. And
right.
If you have dysbiosis, you're guaranteed to have the beta-glucuronidase in there. So that's why it's good to have a good balance of good and bad bacteria. Take something every day like colon cleanse. What it has in there is magnesium citrate. It's got Cape aloe. and it's got triphylia extract, which have all been used for centuries with safe use in humans. And so it's been very effective for centuries, and we put them all together and give you the best general support that you can take daily for your colon, for constipation, the colon cleanse.
Yeah. Yeah, it's kind of interesting. What about GastroHeal? I tell people you're trying to heal stem to stern, whether it's esophagitis, acid reflux, gastritis, duodenitis, inflammation of the small bowel, we call microvillus inflammation, where if you did a biopsy, you look at the villi, look like they're all chewed at. Or if you've got an erosion of your colon, sigmoid colon, like we call sigmoid inflammation of the sigmoid colon, which is the lower bowel. They all are helped by the GastroHeal, which is zinc carnosine. It's pretty amazing stuff, isn't it?
It is, yeah. It's a chewable form of zinc carnosine, which is great because you really don't absorb it as zinc. What it is more of a topical ointment for any kind of ulcerations that are going on in your lumen. And so by having it be chewable, it actually can coat any kind of abrasions or ulcers that are in your mouth all the way down to your rectum. So very effective. Kind of the similar type of issue. If you had any burns on your arm or anything, you'd use a topical salve or ointment to help heal that.
Yeah.
And this is,
exactly.
So this is an internal form of doing that.
A lot of time people think that they can second guess our probiotics. And I'll talk to people and consult and say, well, what are you taking? Well, I'm taking XYZ company probiotics. I say, don't. Take ours. We have the living probiotic, which is a Brazil 6 strain, the top basic Pasteur Institute strain from Paris, France. And then our living probiotic ultra is the most powerful probiotic on the planet. If you don't recolonize with these really persisting organisms that are going to stay in your bowel and protect it and act as a bouncer to bounce out parasites, pathogens, mycobacteria, and fungi, you're going to get recolonized with bad bugs just the next meal you have. And even making you bulletproof against things like viral and things like norovirus, and other ones that you pick up in restaurants or in a cruise line. You need to have a super probiotic. So when people are saying they have bad digestion, I'm thinking, if I was to send you off for a CDSA2, which is CDSA number 2, at Genova Metametrics Labs through directlabs.com, and they did DNA probes and other culture techniques to find out exactly what's growing there, it's bizarre and awful what's happening in most people's bowels. It's just like a nightmare. And so when I hear people say that's constipation, I think, well, that's just constipation. You just need to take fiber. It's a lot more than just fiber. It's a big deal. When we come back, we'll talk to Clay some more and get some more wisdom on how to treat things like sciatic pain and back problems and others. Back in just a moment. Nutrimedical report. And let's talk about sciatic pain, low back pain. And there are only 4 structures in your spine that's actually innervated with nerve supply. 75% of the A delta and C fibers that give pain signals are from the facet joints on the other side of your spine and the sacroiliac joints. The other 25% is split between the ligamentum flavum, the yellow ligament in front of your spinal cord, and nerve roots, which below T12 are all just, we call it the horse's tail or nerve roots. There's no spinal cord at this point. And the back of the annulus of the disc and the dural nerve sleeve, which is around the nerves, as the nerves exit the lateral frame and for the spine. And the first thing I recommend for people with sciatic pain is, number 1, Inflamex. This is the Wobenzyme N formula, but it's 10 times stronger than the old formula, designed in Germany some 30 years ago as an enzymatic, but it also has serrapeptase, so it's Inflamex, and it's 10 times stronger, which is why the X is there, plus it has serrapeptase. Can you tell us about it? Because when people have got interfascial adhesions, which is very often on sciatic nerve, they've got an anatomic entrapment by interfascial scarring or adhesions between the different heads of the piriformis muscle that grab the sciatic nerve and pull in the dural nerve sleeve or compress it. And there's a number of pinch points between the spinal cord and the end motor end point where the nerves can be entrapped anywhere in the body, whether it's carpal tunnel or ulnar cubital tunnel syndrome, or in the foot, tarsal tunnel syndrome, in the sciatic area, depending on your anatomy. And sciatica, low back pain, facet joint problems, Inflamex is amazing. What's in it and why is it so good?
Yeah, well, it's got in the pancreatin, it has papain from papaya, it has rutin, it has bromelain from pineapple. You have trypsin, serrapeptase, and chymotrypsin. So really, everything you need to help get rid of excess damaged tissue around the joints, around the organs, within the body, just like little Pac-Man in there to break up proteins and damage tissue. What do you think?
Yeah, and not only that, I think people don't understand that there's what's called the enterohepatic circulation, that the body packages in liposomes. Some of the digestive enzymes come out of the ampulla vata from your pancreas into the second part of your duodenum. And I believe your body has a small capacity to generate enough of these enzymes that they work at a distance to actually get rid of blockages of your lymphatics and extracellular tissue that needs to be broken down. But that is very deficient in everybody. And so when you take Inflamax, and again, I tell people never, ever, ever take a non-steroidal anti-inflammatory drug. If you have them in your cabinet, don't throw them in the toilet because they're toxic to get in the water supply. Take them to a biohazard container or to the pharmacy to get rid of them. Never, ever take non-steroidals. The next two are tendon mender to change the tenocytes, which are special modified fibroblasts for your tendons and connective tissues, and joint performance to rebuild your cartilage. And I do tell people to take that along with Collagen Max and Mountain Red Velvet. So let's talk about this combination. Tendon mender, joint performance, Collagen Max, Mountain Red Velvet. It's extremely important to actually rebuild the tissues, because then the pain goes away. Because all pain is trying to splint a tissue that's been damaged or about to break, where there's micro tears in the connective tissues or the substance, and there's local reactions are being released, chemicals like SRSA, slow reactive substance anaphylaxis, bradykinins, neurotenins, and other neurotransmitters indicate pain and splinting and vascular spasm. And the tendon mender, joint performance, and Collagen Max, this trio is amazing, isn't it?
It is, yeah. I love having the Inflamax component, starting off with that and then adding these others in there, especially the Collagen Max. That's choline stabilized organic silica. It really gives the body the raw material it needs to rebuild the joint and type 1, type 2 collagen. And it also works very well. And
elastin. And also hyaluronic acid in your eyeballs and your skin, so your skin plumps up. And in the elastin layer in your aorta. In fact, I tell people as soon as they call me or email and say, Dr. Deagle, I've got a expanding aortic aneurysm, I say, we can stop that. You don't want to rush into doing an aortic vascular graft, because 5% of the people that go through the surgery die. It's a big deal. And why put somebody through a deadly, dangerous surgery, which also they're going to have possibly throw emboli and go on a heart-lung bypass machine, which will throw microclots to their brain so they get post-surgical, I call ECMO brain. And when all they need to do is start taking Collagen Max, and the body starts to build up the strength of the artery wall, and they stop expanding their aorta. It just stops. It's amazing. Just take Collagen Max and Mountain Red Velvet, and your aorta is stabilized. It's amazing, isn't it?
Yeah, sure is.
And no need for the surgeon. The vascular surgeons are going to have to find alternative ways of paying for their yacht. Pretty bad, hey? Topically, I tell people deep tissue massage. I like the curcumin cream. Our MG12 product, I tell people to use Magnasport magnesium oils, and also what's called the Healing Body Balm, which they can do deep tissue massage along with curcumin cream to actually break up the interfascial adhesions that are causing sciatica and problems. And the Topical Technologies are micropulse to the areas of the back, and Lumen Photon setting 7 for pain and Nico for healing. And of course, any condition will improve with mild hyperbaric oxygen, but you don't need to do all those. In fact, I tell people a lot of time, all they need to do to start off with is take those top ones: Inflamax, Tendon Mender, Joint Performance, Collagen Max, and Mountain Red Velvet, and they're all set. So that's how you deal with low back pain. And if you needed to we call distract or pull the tissues apart, the best treatment is called DXR9000. DXR9000, and a lot of chiropractors have them, physiatrists, neurosurgeons, rehab doctors, occupational physicians. DXR9000 is the best way to distract and decompress it if there actually is a physical compression. And don't rush into doing spinal surgery or spinoplasties and so on, which fuses the area. That's another insane surgery. Should never be done. The spine, you need flexion extension MRI scans to determine if it's actually an anatomic entrapment. And you need to have it done with a radiomagnetic dye, technetium-99 dye, to determine it. It's much more accurate to do an axon 2 scan along with flexion extension MRI. And if your radiologist doesn't know how to do it, I actually work with a top radiologist developing the technology. and the interpretive analysis back in the 90s on flexion extension lumbar MRIs. And the problem is the doctors are sloppy and they get away with it because other people don't know, including lawyers. They don't know how the limitations of the application of the technology that these doctors are using. Next one is an interesting one. Scabies, which is most people realize before the 1929 crash there was a major explosion of scabies for the few years before that. And believe it or not, we're having another scabies explosion. So I think the bed bugs come around just before to make you itch like crazy before the economy has a major correction. So it's scabies time.
What is scabies?
It's a scabies mite, basically. It's a small, infected mite. It's not like the dermacenter mite that actually crawls out and on your skin at night. It has a red light district on your skin and then reproduces and then goes back and crawls into your sebaceous glands and your pores. The scabies is bigger, and it's nasty. It's like a blood-sucking monster. And what happens is bed bugs will actually suck your blood so they can infect you with stuff, including viruses and so on. And then they crawl back into the furniture and then come back out and get a blood meal. So they're sort of like I call a microscopic vampire bug. They're nasty. So I recommend spraying 1 to 5 dilutions of Nutrimedical. Take Nutrimedical orally, 15 to 20 drops 3 to 4 times a day. But Allicin Med, now this is a nice thing about Allicin Med. If you give your dog Allicin Med, open up a capsule, put part of it in their dog food, or you take it yourself, mosquitoes and ticks will not bite you. They go, not today. They're not going to bite you because there's a what's called a sulfuryl odor that literally is a repellent against any kind of biting insect. They go say, this is not my malt shop. I'm not going to that guy or that dog. So Allicin Med is kind of cool. It actually will repel scabies, insects like, biting insects like mosquitoes and ticks. So Allicin Med. And then, of course, to turn off the inflammation, curcumin cream, MG12 Magna Soap, and, of course, the Healing Body Balm, and, of course, back to Inflamex to stop the inflammation in your tissues and to heal after these nasty bites. Nutrifos for the phospholipids, Collagen Max, and Omega Fatty Acids, Omega Supreme and Omega Supreme Krill to re-heal the tissues that are damaged by the nasty bites. So we have Clay Crossan here. We're talking about Clay. We're talking about ear infections and lung congestion, and I get a lot of requests on this. One of the first things to talk about, let's talk about allergy. And this is the allergy season is pretty rampant. There's a lot more allergens in the air because there's more pollutants. Pollutants attached to allergen molecules, radiotoxins like Fukushima, or if you're near a nuclear plant, or any kind of industrial pollution. And of course, indoor air pollution includes fungi and molds and so on. And 1/4 of homes and 1/3 of all businesses actually have grow mold inside the building somehow. And mold toxins attached to allergenic molecules like house dust mites and even outgas things from your furniture. So we have Allergon and Allerblock to start with, and the vertical nasal spray, Silver 100. Sinupulse Elite with Nutrimedical, and use Sino Air powder to keep it osmolar to make sure it's the right osmolality with either distilled water or pure water system water. That's kind of like the start. And then, of course, for the immune system, NutriDefense to boost your immune system to fight allergens. And to clear them, a lot of time people don't realize when you have an allergen, you really have a chronic infection in your sinus cavities, your airways, and your basket cells, and your bronchi, and your respiratory bronchioles. So Allicin Med, Nutrimedical, and to turn off the inflammation in the bronchioles is cell detox glutathione, and to heal the walls of the bronchi, Nutrifos, cell defense to turn off the inflammation, an Omega Supreme Krill, especially because of the astaxanthin, and of course the silver spray to inhale usually in sets of 3. Take 3 puffs, hold it for a count of 10, and repeat at about 1 spray per 10 or 20 pounds body weight, depending whether it's acute or preventive thing. If it's acute, it's 10 pounds. So let's start at the top, Allergon and Allerblock, and things like our Allicin Med. Let's go over those if you can, Clay.
Sure. Well, the Allergon is what it is has diamine oxidase, or DAO, and it's an enzyme that the body produces to block histamine, excess histamine, specifically from the foods that you eat. And so some of the foods that are high in histamine are things like cured meat, cheeses, beer, wine, a lot of the good things that I like to eat, of course. have a lot of histamine. So when you take them, if your body doesn't have enough DAO, what happens is the histamine causes inflammatory response, and it attacks all kinds of different areas of your body. And whatever you're weakest in is where you typically have your reaction.
Yeah. Yeah, you know how it works, too. It's interesting. It's histamine bumps with like a cue ball, a thing called interleukin-1 beta. And interleukin-1 beta is what's called a fulcrum cytokine. And when you hit it, it hits the cytokines IL-6 and a number of other inflammatory cytokines like tumor necrosis factor alpha, IFN gamma, so that when you get rid of diamine oxidase, which actually gets rid of with the allergon, it's an enzymatic that gets rid of histamine, your IL-1 beta and these other inflammatory cytokines drop dramatically. So it doesn't just matter if it's allergy, if it's autoimmunity, or if it's due to environmental sensitivity to chemicals. The allergon is going to help reduce that inflammatory reaction of your sinuses, your airways, your bronchi. Pretty important stuff.
Oh, very good.
And of course,
yeah.
And the Aller Block, tell us about that one. That's a good one.
Yeah, the Aller Block has vitamin C. It's got quercetin, which is a level 5 antioxidant. It's got stinging nettle, bromelain, rutin, NAC, and it also has a pharmaceutical form of quercetin called dihydroquercetin. That comes from a large tree extract, so it is natural, but it's super powerful. And what's great about the Aller Block, it's typically used to support seasonal allergies and helping to stabilize the mast cell so that when histamine comes in, it doesn't disrupt the mast cell.
Yeah, and that's really important. Allison Med, this actually gets rid of a lot of the garbage. People don't realize, and of course it's very hard to culture some of these bugs out because they're often we call nanobacteria, mycobacteria, fungi, viruses like what's called rhinovirus subclass 3 actually can grow in the bronchi. It's very hard to scan, to find out unless you do scanning electron microscopy or advanced immunology testing with staining of a biopsy of the bronchi. But Allison Med will penetrate through the biofilm and clear all these pathogens out. They call pathogen soup. And, of course, they use that along with their Nutrimedical, cell detox glutathione. Most people aren't aware that you can actually make a glutathione inhalation spray to turn off asthma. And the naturopaths will do this. I like the ordinary cell detox glutathione that goes through the bloodstream because as you raise the bronchial and the airway and the sinus cavity glutathione levels, the primary oxidant there is hydroperoxy radical, and it turns it right off. It's really good for asthma, chronic sinus, chronic block eustachian tubes in the middle ear if you're flying a lot. So cell detox glutathione is very good. And then to heal the sinus cavities, the airways, Nutrifos, and cell defense, really, really important, those two. Can you tell us some details on those things like glutathione, cell detox glutathione, Nutrifos, and cell defense?
Yeah, the cell detox glutathione is one of my favorite products that you have. And it is S-acetylglutathione, and this is the best oral form of glutathione on the market. It's the best absorbed, effective as IV therapy glutathione, which we know can be very expensive, but it is very effective as well at getting glutathione into the plasma.
It doesn't last long. We gave it in our hyperbaric clinic back in the late 90s in Denver. And what we found is that the IV glutathione, we actually could do blood levels, only lasts in the bloodstream after you give a big bolus of it for 45 minutes. But our S-acetylglutathione will last 12 hours plus. So if you take one capsule twice a day, or two twice a day, or three times a day, you'll find that you maintain a good high level throughout the tissues of the body, from the brain, where it helps protect oxidative stress, to the heart, blood vessels, lungs, everything. So it's a very, other than nitroperoxy radical, hydroperoxy is one of the nastiest out there, and glutathione peroxidase is very, very important, and this is amazing how effective it is. What about Nutrifos for rebuilding the airways and cell defense, for turning off the lung membrane inflammation?
Well, phosphatidylcholine, makes up the cell wall. And so I do love omega-3 fatty acids, but the omega-3s would be like just giving a builder glass to build your house out of. Whereas if you want to give a builder something that's really sturdy for the house, you give them phosphatidylcholine, which is in Nutrifos. So it's not just glass, it's also the building materials for the house.
Yeah. And by the way, the kind of omega fatty acids, I use Omega Supreme Krill, especially for what I call lung membranes and so on top of the Nutrifos because of the astaxanthin. Other than our NutriDefense polyphenol, the anhydrous catechin, this is the most powerful antioxidant you can take, and it's the only krill oil in the world that actually does have real astaxanthin proven in laboratory testing to be still present in the bottle. It's not just on the label. So when people follow my protocol and they've had asthma, it goes away. They don't need rescue inhalers, they don't need steroids, they don't need interventional emergency visits to the hospital and putting them on a ventilator if they get really bad. It just stops. So when people say, what's asthma? Asthma is interleukin B2, D4 and B4, and the chronic infection of the basket cells with mycobacteria, fungi, and rhinovirus subclass 3. And if you get rid of the stealth pathogens, heal the membranes, and stop the vasospasm and angioedema, the asthma and the bronchial chronic bronchitis and so on goes away. And by the way, asthma and chronic bronchitis are not benign. They eventually damage your airways, and you get drop out and damage for your alveoli, and you get we call fibrous changes in the elasticity of the bronchi and the airways, and you actually lose the ability to oxygenate blood. So it's not a benign condition to have chronic asthma or COPD. It will destroy your lung tissue over time. So doing this protocol is what I call cellular and metabolic hygiene. It will prevent you from destroying your lungs as you get older. And then you don't want to run out of lungs before you run out of life. Bad idea. Well, Clay, we only have a minute left. I want you to kind of, I really appreciate you coming on every week. We're going to be doing some other interesting things coming on in the next few weeks. I think that what people should realize is when they look at our Nutrimed protocols, we're bumping it up a few notches, going to embed a lot of video clips. We have, of course, are now advanced consults, so you can actually... If you send me a whole pile of records, I'm just going to send you back to say, hey, we need you to fill up my intake form. There's a fee for doing an advanced analysis. If it's just a quick and dirty, what do you do for A, B, and C? I don't charge, and here you go. Take 1, 2, 3, and there you go, or a little more advanced. But if I get a lot of records, I'm going to request that you fill up my consult form and the fee to get started, to do a proper consult so you actually get the redirection to the right types of doctors, surgeons, technologies, and most importantly to our NutriMeds, because if you're not fixing your body metabolically and nutritionally with natural molecules, what are you doing? Certainly the body is not sick from a deficiency of toxic polypharmacy. Thank you, Clay. We'll see you again next Monday. And coming up in hour 2, Ryan. And by the way, every hour of the show is open lines, 800-259-5791, 800-259-5791. Call in and raise your question. We'll be back in a minute with Ryan.